Hello, my name is Terry Sarantu. I'm a surgical oncologist at the Levine Cancer Institute. Today we're talking about pain management and opioids. Pain management with opioids is a multimodal pathway. Obviously, pain management with opioids or narcotics forms the basis of much of the pathway of pain, but there are other ways of pain management too. We're going to focus mainly on opioids this afternoon, but feel that we should educate you also on other mechanisms of treatment. Obviously, there's the pharmaceutical treatments, and these are the opioids, and there are many different opioids that are available. There are also other medications such as nonsteroidals and acetaminophen. There's physical therapies that can be used. There's other tactile therapies, there's music therapy, there's acupuncture, so many different types of therapies. So please ask your physician regarding additional options that may be available rather than just opioids. There are many types of prescribed opioids that are known by several names. These include codeine, fentanyl, hydrocodone, oxycodone, oxymorphone, and morphine. These medications are sold under brand names such as OxyContin, Percocet, and Vicodin. The different types of opioids are prescribed by doctors in different strengths and administered in various forms, dependent on the patient, their medical condition, and the type and level of pain. Some of these medications have been heavily mentioned in the opioid crisis and are no longer available. What's important is prescribing with precision. This means that you need to work with your physician in terms of the appropriate dosage that works for you. There are many different types of doses that are available, and you should really work with your physician and team in order to get the optimal dosing that will really help you maintain a good steady state of pain control. We want you to avoid periods of time that you don't have pain medicines and then you overcompensate by taking more pain medicines than you need. The number of pain medications that will be prescribed to you has been determined by national societies in terms of what is felt that is adequate for the type of procedure that you need. Obviously, you may require either less or more pain medications, and please have a discussion with your physicians and team regarding how many pain medications you think that you'll require and how many pain medications you should be discharged with. Please remember to take opioids only as directed. The time period that's prescribed is very important, and you should take them and adhere to the time period that is relegated on your prescription. Please call your physician if your pain is not under control. Again, you may need a different dose or a different type of pain medication. Not everyone reacts the same to the pain medications that they're prescribed. Watch out for side effects. The side effects can range from very mild ones, including sleepiness and constipation. So please be aware that you may be overly drowsy and don't put yourself in situations where you may become injured. And constipation is really important and is something that you really need to try to avoid. Please try to drink plenty of water. You may need to take a stool softener. This is important. Other more serious effects of opioids are shallow breathing, a slowed heart rate, and even loss of consciousness, and this could be serious and could be signs of overdose. Don't use alcohol with opioids. Both of them are sedatives, and using alcohol with opioids can be life-threatening. Use your opioids for surgical pain only. If you need something for sleep or for something else, please ask your physician. Please only use your opioids for surgical pain only. As your pain gets better, wait longer between doses. Another thing that you can do is as your pain gets better, you can alternate doses of opioids with either nonsteroidals or with Tylenol, so you won't be having to take opioids on a prescribed basis. And really follow your doctor's instructions about taking other medications. Review your medications with your doctor and go over a plan in terms of taking those other medications and if there are any interactions. It's really important that you safely store your drugs. You want to store the drugs in a cool place, in a dry place, and in a place where others may not be able to have access to them. You want to dispose of unused drugs, and ideally through a medication take-back program. This is where you would actually package the drugs and you would take them back to either a physician's office or to a pharmacy where they have a mechanism in order to destroy those medications. If you must destroy them at home, There are instructions that you can find in the app in terms of getting resources. But something that you can do that's practical is that you can either use a charcoal, activated charcoal, or you can use cat litter, and then you can dispose of it that way. It's important that you dispose of your medications because a high number of home invasions are due to individuals seeking opioids. Don't share your medications with others, and diversion or sharing or selling of opioids is considered a felony. Educate yourself on opioids. The app will provide certain links for additional resources as to how you know to using alternatives and educating yourself in terms of how you should be using your opioids and other medications that are available to you. Think of it as a pain management guide. What types of medications do you need to take in order to feel better and make sure that your pain is controlled? Is it a small amount of pain that requires a non-opioid or an oral medication that's non-opioid? Or is it more severe pain that may require an opioid medication? If you feel that you need a refill, please contact your physician. But also please realize that a telephone call may not be sufficient in order to get a medication refill. Certain rules and restrictions that you need to visit your physician to obtain a refill. So please don't think that you can call and get a refill. Thank you for watching. Opioids are powerful sedatives, and the appropriate use of opioids is very important. In the app, you'll find links to resources that will provide you with education and help you move forward safely in your journey.